Great. So, good evening and hello, Magdi.
Hi, Phil. Thank you. How are you?
I'm well, thanks. Thank you very much for agreeing to share a few words with us about chronic kidney disease and Ramadan. We all struggle a little bit in primary care about knowing what the best advice is for our patients with chronic kidney disease, and I'm hoping that you'll give us some tips so that we can pass them on to our patients. Really, we often get asked, what should I do in Ramadan, and can I fast or should I not fast? But with that in mind, I wonder if you had some broad ideas that would help us.
Right. Thank you very much for asking me to share my views. As you know, it's a very important period for Muslims all across the globe, and even more now with what's going on with the corona pandemic, which brings its own problem, as there won't be any congregation prayers, and people will be doing their own fasting in their own little home.
It's a very difficult time for everyone, isn't it?
The community spirit is gone, which is the main focus of this holy month. Having said that, this has been an ongoing question which patients with kidney failure do ask me as a specialist, and I'm sure you would be asked even more. There are few very easy issues which I can just say up front, that a person who is on regular dialysis, whether he's on hemodialysis coming to the hospital 3 times a week, or he's on CAPD, they don't have to fast. They are too ill to fast. And the reason is that when they are dialyzed, a lot of nutrients leak out from their body, which creates already a fasting scenario. Plus, they need to take their regular medications. And
so really what you're saying is it's not that they just don't need to, they really shouldn't, if we're asked.
I would say it is mandatory for them not to, because in that scenario, it's clearly stated in Holy Quran, which there is no controversy across any Muslims all across the globe, that if you are unwell and it is likely to harm your health, then you should not fast. It is the same that you are asked to pray and you don't pray. That is a sin. But if God is telling you not to fast and you fast, that is a sin. I'm that direct with them. I said that if there is been told that you are not supposed to fast and you are fasting still, it is you are disobeying your creator. It is that strong message you got to give them, because still quite a few people will feel guilty that they are not fasting because everybody else around them is fasting, so they feel left out in some way. And second thing is that it's a ritualistic size that now become a routine for many Muslims. They do it without even thinking why it is there. But we don't want to go into what's the pros and cons and what the religious background of fasting is. But for those two patients, straight no, Phil. This, I would say that advice is very straightforward, that it is a sin for you to fast because you will cause harm to your health, and God does not want any. Religion is there to ease your life. Religion is not there to make your life tough.
Okay, so that's very clear with patients on dialysis, be that hemodialysis or peritoneal dialysis. What about transplant patients? How do you feel about that? Is that an individual issue, or is there guidance for patients who've had a transplant?
So in transplant, if again I will come, which will be covered in the next question, which is chronic kidney disease, that most of the transplants when we do, that does not restore their normal kidney function. And most of the transplants which we have now, their kidney function is in percentage term or EGFR term is less than 45. And those guys should not be fasting, whether they are on transplant or not on chronic kidney disease. But if they are above 45, you are in some circumstances allowed to fast, but the fast got to be 12 hours or less.
Okay.
Timing of the immunosuppression tablets which is the most important thing for that kidney not to get to any harm if you were to take your immunosuppression drugs at any time. That would cause harm to the kidney and you will end up losing that kidney. So if the fast duration is less than 12 hours, like it was winter time, that set in, if the fast is in December, yes, there is around about 8 hours fast time, and that's perfectly okay. This year, when I calculated for our first fast, which is hopefully will be on Thursday, subject to sighting of the moon crescent, it's going to be 17 and a half hours. So it means that immunosuppression drug, if they were taking it, would be separated out by a gap of 17 and a half hours. And that is clearly not allowed. And that's again with the same strong message as what I said about dialysis and peritoneal dialysis, that you're not supposed to fast. If you do this and you lose your kidney, then you are committing a sin. Somebody somewhere along the line did a favor by giving his kidney to give you a better quality of life. If you, by doing this, you are going to harm your health and your kidney, then you are committing a sin. Because in Islam, it is said very, very clearly that the body belongs to God. You are just simply the custodian of that body. So you've got to look after as if it belonged to somebody else. So somebody has given you something to keep in your house, Phil, and you will look after that to the best of your ability because that person has put a trust in you. It is the same trust when it comes to human body between God and the person. If you were to not look after that body to the best of your ability, then you are breaking the trust with your creator. So here, in transplant setting, if you don't look after your transplant, and clearly, if you don't take your tablets 12 hours apart, which is immunosuppression drugs, your kidney will come to harm almost certainly. So you are not supposed to fast. But a time will come when Ramadan will hopefully soon come in December or January. There is a hope for that because we want to give transplant so they can live a life. But in those months, they would be allowed to fast, provided the GFR is greater than 45.
Okay, so that's again, that's very clear advice, and that's something that we can advise patients that the time may come when Ramadan hours are shorter, as we're moving back towards Ramadan in April and May and March and then February, that a shorter Ramadan will allow fasting for that group of patients. So now I guess we come on to the CKD patients who we see. Obviously CKD 3 lower than 60, and eGFR lower than 60. Where do you pitch the advice at this level to patients with CKDs of 60? You mentioned 45 as a cutoff. Is that something you advise people in clinic about?
Absolutely. And there is a reason, and there is a physiological reason that if you are going to go without any fluid, which is from 3:30 a.m., I think that is where the start time would be this year, and ending time will be 8:15, 8:30. During this time, you're not taking a single drop of water. I'm bothered about the food. You can go without the food during that time. It is the water or the fluids. And at the GFR of less than 45, as you know that if with a normal kidney function, your kidney can concentrate the urine to the level that you can only pass 400 mils to get rid of all your impurities. But when it comes to GFR of less than 45, kidney loses the power of concentration. It will still remain polyuric. So when you are not taking water or keep up to speed with your fluid intake, during that 17 hours, you are more likely to get dehydrated as compared to the person with normal renal function. Because in kidney failure, with particularly GFR of less than 45, kidney cannot reduce urine output. It will continue to pass more water. So there comes a scenario when you are repeatedly on daily basis getting dehydration, or what we will call repeated acute kidney injury, which would then lead to rapid progression of kidney failure. And the person would then come to harm. So from a GFR of around about 44, merrily going, and many more years left in that kidney, it's quite possible that by the end of the Ramadan, with what I said just now, you will be losing more rapid decline of the creatinine, GFR, and you might end up with the far worse matters in over 1 month period. And all the gains we had, all our gains are just gone just in 1 month. And again, a risk which is not required. It is clearly explained in Holy Quran that if you are chronically unwell, and that definitely comes in chronic illness, which is GFR of less than 45, they should be told not to fast and adhere to their tablets. And in return, there is even a session for them, that if you were to tell them that in Holy Quran is written that if you can't fast because of your health, if you were to in return feed one poor soul anywhere in the world, you will get the same reward as if somebody is fasting. So even God has gone to that extent to explain the believers that, look, there is a concession for you. And I personally think, and I feel very strongly, that if there is a mention in your scripture you should follow, if you don't follow that, then it is the same sin as if you are not praying or you're not living the life according to the doctrine of Islam.
Okay, that's also very clear, and that's something that thank you for explaining that, because I think when we come to have these difficult discussions with patients about fasting in Ramadan with chronic diseases, I'm not sure many of us would have known that actually you can do extra damage if you have an EGFR under 45 and you do fast. I think that's something that you've made very clear. What about the patients who then have an EGFR between 60 and 45? Are there any tips if they want to fast, having explained to them that maybe it's not a great idea from the kidney function point of view? Are there any tips in that group of people that we can help them in terms of advice about fasting?
I think the main thing is that there is on this trend that the morning breakfast which we all have is brought forward to 3 a.m. So this is how the whole thing, and we call it suhoor. That is before the sunrise. You get up at 3, do your breakfast which you used to do at 8 o'clock or 7 o'clock before we're leaving. They do that at 3. And they break the fast. And many of the people, because they don't want to get up at 3, they go without eating anything.
Right.
It's literally a 24-hour fast. So that's the first advice we give them, that remember at 3 o'clock or whatever the time you have to get up for your, if you remember the spelling, it is SUHOOR, it's called suhoor, that you should get up for your suhoor and have a good hearty breakfast, but early suhoor in the very early morning.
And drink plenty at that time?
I think what happens is that when they drink, it all comes out in 2 or 3 hours anyway. So I would say that moderate drinking. But for the tablets, I always advise them that most of the chronic kidney disease patients, apart from diabetics, they would be on antihypertensive tablets. And I always tell them to, if they were taking it in the morning, I tell them during month of Ramadan, you should take it after breaking your fast in the evening. There are now some evidence emerging that taking antihypertensive at night is better for your heart as compared to daytime anyway. So we are well within even the guidelines of switching antihypertensives, all of them after the iftar, because from 8 o'clock till 3 o'clock, they still, you can eat, you can drink, whatever you want to. With diabetes, if you are on insulin, it is a big problem. And so insulin, if it is just once daily dose of insulin, which many of your patients would have it in, I think, in the primary care, that they're taking one long acting with few tablets. They again, in my opinion, should be taken after iftar, which is after breaking the fast.
Yes.
So
I think we're going to get Taz in to try and talk to us about the specifics of diabetes, but absolutely right. Yes, we have a lot of patients who are on just once daily insulin, which usually is at night, but not exclusively. So that's a very good tip. Thanks for that. So in summary, Magdi, am I right in thinking, if I've taken your points on board, that we should be advising our dialysis patients, be it peritoneal dialysis or hemodialysis, that it is really harmful to fast during Ramadan, and that they should be seeking other ways of being spiritual during the holy month? That for those patients with EGFRs under 45, we should be trying to explain to them that actually fasting could result in them damaging their kidneys more because of the nature of the physiology of the fasting process. And also for patients who are transplant patients, that very precious kidney can be damaged by fasting during the Ramadan period. And again, that there may be some scope when the Ramadan hours are a bit less onerous to fast, but in these hours where it's up to 17 hours of fast, then that's not a good idea.
I think I always sell it because some of the elderly, particularly the transplant patients, they would try to convince me that, I got the transplant so I could fast. So I tell them that you can still do your non-obligatory fasting to satisfy your spiritual side during December. It doesn't stop you doing that. So they are very happy that I'm allowing them, not this month, but when comes December this year, they can do few fasts to just get that spiritual side going in their body. So I think they feel very happy. But there is that ray of hope for them, for transplant particularly. And they feel very happy that, first of all, they are more convinced they shouldn't do it this time, but they would be able to do it when in future Ramadan comes in December, or I think November, December, and January. These are the 3 months when it is in those months they can clearly fast.
That's wonderful. I think that's it. That's a wrap. Thank you very much indeed, Magdi. That's incredibly useful, and we'll share this with colleagues across the area. Thank you very much.
Thank you so much, Phil, and hope as this pandemic is over very soon.
Yes, we all do. Thank you.
All the best. Bye.